You're watching WSBT 22 News at 5.
January is Cervical Cancer Awareness Month.
That's right, and doctors at Beacon are reminding women to get back on track with screenings. It could save your life in tonight's Eye on Health. The pandemic triggered substantial disruptions to health care.
We were already having a hard time getting people to the doctor routinely, and then all routine things stopped. And so because of that, we then fell even further behind the 8 ball in terms of screening for cancers.
According to the CDC, screenings for breast, colorectal, and cervical cancers dropped more than 80% during the early months of the pandemic. And experts say there could be consequences to that pause.
I'm expecting it, the lapse in care, and not so much that the pap smears, the screenings are necessarily going to combat cancer, but that there's going to be changes that are going to need treatment.
Cervical cancer is treatable, but it's not like many other cancers. It's sneaky.
It doesn't necessarily cause pain, doesn't cause us to feel bad, so we don't even pay attention. That's the scary part.
Early stage, there are generally no signs or symptoms.
It doesn't have symptoms until it's very advanced. And so the way to prevent it and to catch it early is to make sure that women are showing up to their doctor's offices and getting pap smears.
A pap test looks for cancer or precancerous cells on your cervix, and HPV, human papillomavirus, the main cause of cervical cancer.
HPV is very prevalent, and that basically means that if you've ever had an intercourse with anyone who's ever had intercourse with anyone else, more than likely, you've been exposed to human papillomavirus. So it's very, very prevalent. Now, typically, the immune system clears human papillomavirus, but when it doesn't, human papillomavirus can then cause precancerous cells that eventually become a cancer.
And advanced cervical cancer is much more serious.
Women can present with abnormal bleeding, bleeding with intercourse, bleeding in between periods. When it's really advanced, oftentimes women can present with pelvic pain, leg swelling, back pain, or even shortness of breath if it has metastasized or spread to the lungs.
It's real, and that it can be treated before it even gets to cancer. And so that's really my role here, is to come in, have your exam, have your screening, so that we can prevent it from even, if possible, ever happening. Because it's very treatable, and no one wants to hear that scary diagnosis of cervical cancer.
We can save lives. We can prevent so many deaths if we can get people just to show up to the doctor.
The general guideline is that women begin those screenings at 21 and until the age of 65. There is also evidence that links smoking to a higher risk of HPV, and HPV causes other cancers as well. There is a vaccine that's 99% effective. It's routinely given to boys and girls around 11 or 12 up to age 26.